wanting to talk to you about knee pain this month. So a lot of questions that we end up having is people complain of knee pain when they're going up or down stairs, they're doing deep squats, or even just kind of coming down and like bending down on their knee. So most common diagnosis for these, depending on your symptoms, is typically what's called patellofemoral syndrome, which is where your kneecap is resting against your femur bone, and it's just having too much pressure and compression there. So one of the biggest complaints with this one is typically pain when you're going downstairs because your quad muscle is not doing enough work to hold your kneecap off of the joint, and so it's causing pain. The other big one is if you sit for a long period of time and you kind of feel like you're constantly having to move because of knee pain. That's typically a patellofemoral sign. And then the same thing with the deep squats, because again, that kneecap is just rubbing up against that bone causing your pain. So one of the things that you really want to work on with this is your lower quad strength and your hip strength, because your hips actually play a very large part in your knee pain. Your hips typically are weak, which then will cause the knee and the kneecap to ride against it because it's not getting the support it needs from the additional muscles. And then the other most common kind of symptom or diagnosis is osteoarthritis. Our knees take a lot of beating because they're the biggest function of doing activities. They have a great range of motion, and they take a lot of pounding from walking stairs, running, squats. So what happens over time is when your muscles aren't strong enough or they are too tight, they can cause imbalances in your knee range of motion and your strength. It can pull on one side more than the other, which can then eventually, with enough compression and rubbing, it'll cause some arthritis, which can be an addition of bone growth, of cartilage that can be uneven and causing pain when you rub up against it. So to kind of help reduce this is you want to make sure that you have enough range of motion. So if you notice that you're not able to bend your knee or straighten it as much, you want to work on those motions. Making sure, because the more motion you keep for longer, the better you're going to be able to walk and function later in life. And then, again, the same thing, you want to strengthen those hips. It can also sometimes come from the feet up, so you want to make sure that you're wearing good shoes to make sure that you're not having that issue where your foot is overpronating and causing symptoms up into your knee. So changing your footwear about every 6 months if you're a pretty good exerciser. Shoes break down, that's why we need to replace them. Hope to see you soon.